In today's episode, I'm excited that I'll be talking with Dr. Tony. He is a health educator and is out there on social media. He's got YouTube, he's got podcasts, and also is a board recertification lecturer. And so just excited to have him on the episode today. Welcome, Dr. Tony.
Thank you for having me. Appreciate it.
Awesome. Yeah, happy to have you. So why don't you start off with just sharing your story and why you do all that you do?
Became a chiropractor fully licensed in 2002. When Yellow Pages was phenomenal, you basically paid to play. And if you're young enough to not know what it is, congratulations. You're making me feel old. That's fine. Whatever. I'm 51 now. I've been in practice for 23 years. Love it. Love what I do. I still love Mondays. Every day is my favorite day of the week. See my patients again and see what kind of chaos at the office, which is good chaos, hopefully. And a lot of it is if, for example, because you're in practice, sometimes you forget that people don't know us and sometimes don't know chiropractic. When I do my videos for social media, maybe Facebook, Instagram, YouTube, sometimes TikTok too, and share them whatever way we can. It's understanding some people just want an idea of what does chiropractic do and keeping that as simple as possible versus getting into bigger words. I call them 3-syllable words. I try to use them because people really just want to get to their emotional side if possible to see what they need that day. And going Yellow Pages again, going back to that, great for about probably the good, maybe 6, 7 first years. And then not only you're paying $2,500 a year, $2,500 a month to pay to play with Yellow Pages and White Pages also back then. But then we saw the return dropping. And then that's when websites came out and then YouTube came out. So doing long format videos back then too was great. Put that out there. Then Facebook, then Instagram, then now TikTok also. And even podcasts also too showed up in between, I think, Instagram. I started mine in 16, my podcast show, or Kids Fine Show, by the way, is understanding where people go, what do people want to see? And can you be in if their face or their post or their interest when they need you? I think that's the key. It's not everyone needs a chiropractor every day. Everyone not back pain every day, but can we get them when they need them? They see in our faces. They know what we do. We're transparent with what our office can do to help them. At that point, going from there, just helping as many people as possible. And seeing when we switched from social media to Yellow Pages, it was a jump. We saw a jump in new patients also. That became people going on Google reviews, Yelp reviews, and I think there's other ones back then too. How to get people on people's faces to build a reputation online besides word of mouth. Once you get them in our door, word of mouth has always been the key for millions of years, I think, whatever people have been alive for. At that point, how do we go from there as a next step to show people what we do? So that's my backstory, why I do social media and why I'm a chiropractor.
Yeah, and that makes sense. And I like what you said about kind of showing for where a person is that day. Because when you think about, you've got so much marketing experience, so like there's a whole journey that they're going on from. Because my own doctor told me people come in to see a chiropractor after they've tried all the other things. Yeah, so it's just kind of meeting them where they're at, being helpful, right, and just helping them, like you said, getting to know, like, and trust you. And so when they are ready to move forward, right, or to do something, or, let's see if chiropractic helps, who's in their face, but who they think of, literally.
I had someone come in last week, Angel, we're a good guy. And he said, I said, why'd you come in, Angel? We saw your stuff on YouTube. We followed your stuff on YouTube. You've done a lot of stuff in the past. Looks like you have a good reputation as a healthcare educator. So boom, that's all I'm hoping for. And sometimes the ROI isn't going to be positive. You're not going to go one video, one person comes in, but can you long-term think of what am I doing? What's my mission? How to get people to see my long-term goal by putting enough out there where it's not just marketing. It's actually education, helping someone feel better. Let them see the adjustment of Johnny over here and see it on YouTube or whatever it is too. And not dramatically, just being transparent. So they come in the office, you lower that anxiety of what they expect when they come in the door.
Yeah, exactly. And for, I guess perhaps initiated, sometimes that might even be like how you're different than others. Like maybe a special technique or, however you.
Well, the technique is going to be based on what they need that day.
Mm-hmm.
I'd never like to be pigeonholed into, I just do Palmer, I just do Gonstead. Great. Those are, fantastic. But what person doesn't come in, usually doesn't come in like, do you do Gonstead technique? I'm like, they come in like, can you help me? I have this problem. And that's what I want people to understand is we can help that problem and educate you first what the problem is and how we're going to help you, then help you and long-term help you become your best doctor by educating you through videos, through word of mouth, through what we do, guide you in the office for one too. So you understand how to take care of your own health.
That's awesome. So, what would you say that you do differently or, that makes you unique, I guess, compared to others who might be in the same space?
Educate the patient and answer questions and be with them with their first initial exam. Myself or my partner, Dr. Weaver, for one, too, we spend at least 15 minutes with them, maybe take some x-rays while we're in the report with them, too, to make them show them their x-rays. So it's how the person learns. We kind of want to get that in there. And when we're talking to someone, are they a visual learner? Are they auditory learner? Are they more touch and feel for one, too? We have a model in the office, too, of the spine. Have them touch the spine and understand what that is. I think the difference is we spend time with them face to face and we spend the time that they need. It's not like a medical doctor where they're on an iPad. Okay, Johnny, here you have this going on. Boom, boom, boom. Here's your script. Extra coming. Go fill it, and I'll see you in 3 weeks. No, it's spending the time with them and showing them that they can trust you because you're with them the whole time. You're authentic.
Love it. Love it. What do you find most exciting about, let's just say, social media and talking to other docs about that or helping them with that?
It's almost understanding that it's a marathon. It's not I'm put one video out and hope it works. It doesn't work. I'm done. It's being consistent. I take my dog for a walk. Boom, post a dog walk with the dog. Go to the beach, post a video with my dog on the beach. It's something where plus here's how to stretch your neck. Here's a testimonial from Sarah of her neck pain relief. So it's mixing it all up. It's understanding that they're looking at you and want to know you first versus going into your office.
Mm-hmm.
What do you do? I guess you're a chiropractor, yes, but what is your lifestyle like? Do you walk the walk? Or do you put out good videos and you go to McDonald's and eat McDonald's for 3 hours? Which nobody does, obviously. Hopefully not. I'm not sure. Hopefully not. But something where are you helping someone? Are you really truly helping the community get better in a health perspective? At that point, walking into just understanding that they can be trusted, I guess. That's the key. Because there's chiropractors in my area. There's about probably 10 of them. We just see it when people come by. I was like, how can we see so many people? We just take care of people. We want to make sure every person who walked in the door, I think we saw 53 this morning in 3 hours. Everyone is taken care of. They leave happier than they came in the door.
Love that.
It's keeping it simple, Sebastian, to where it doesn't have to be, okay, this person this video this week. I talked to them about this. It's like, are you happy with your care? Good. What else can I help you with? Good. Okay, good. See you in a couple days, whatever it might be.
Love that. Well, and I think just being a good role model, right?
Mm-hmm. It'd be a good example, like for someone that wants to get healthy, that wants to sometimes just get in healthcare. I have interns that come in, are my patients ready? Hey, I think about giving a chiropractor, come an intern. Of course, come and shadow. Perfect.
Yeah. Well, I think it's like a lot of people kind of know, right? You can think about even, say the person wants to lose weight, right? They know they've got to eat better. They've got to move better, whatever that ends up looking like. But to see it in action, right? You can start to see oh, okay, here's someone who's doing the things and, oh, here's something they could eat better, right? Or here's a movement they could do better. And so it's actually, like you said, kind of seeing what that actually looks like.
And when you're face to face too, in front of someone, not just video, but in front of someone, you get to see their mannerisms when you talk about a stretch exercise. And you can tell, are they understanding it? Do they really want it? And what else can help them with? And I demo for them first, and we walk through it with themselves too, so they know how it feels. That when I want them to feel it, I want to see when I push them a certain way, a certain stretch one, I'll see their face kind of grimace a little bit, so I know they're uncomfortable. I tell them, great, that's where you want to get to. That's still safe. Now, cause injury, but you have to be uncomfortable to cause a change in your body. And they see it, they go, oh, now I understand. Or I do a posture check with them on the wall too. Really simple stuff. Heels, hips, shoulders, head against the wall. How does that feel? Perfect. Okay, good. That feels kind of stressful in the lower back. Now take a step forward and now put the weight on your heels. And that's ideal posture for you. Let's get you there over time so they feel, see it, and work on it. And they build that habit of over time as they ask them again, next visit, how'd your posture go? How'd your stretches go? How'd your ice or heat go for 1, 2? I had someone come this morning, Deb, she's phenomenal, older lady for 1, 2, great. Very, very sparky, I guess. Because I think I'm going to my class at 10 o'clock today at the 24-hour fitness. I go, are you going to go? Or are you thinking of going or are you going to go? She goes, I'll go if I should go. And I go, I'm going to call you at 11:15 to make sure you went. So she goes, are you sure? I'm like, so at 11:15, I called my staff, hey, call her real quick. and see if she went to her class. So I want them to feel like if they're going to come back in my office, they're accountable to do what I've asked them to do to make their life better. So they start forming habits to get their health better, to maintain those habits so they stay healthy. That's my, I guess, my big goal, if you want to call for patient.
Well, that's awesome. And I mean, it's like you're being there for them in the way that they need you to be, ultimately. They may not need you to show them the exercise they need to do. It's like they know
Yeah.
that, but they might need just like a hand in just like making sure they actually do it, make sure they follow through.
It's something to where they want an end result, but sometimes you know the steps to get there. So I'm helping them get the steps slowly versus having to go squat 500 pounds. Let's make sure we're not causing more injuries for one, too. And I go, okay, you're at a good point now, say within a week or so, where I would green light to start doing more strength exercises. So almost their coach along with their chiropractor, so they feel safe, they can progress further and further into a healthier lifestyle. At that point, maintain that over time. So they don't stop the stretching, but they accumulate more things over time to make sure their body stays healthy.
Makes sense. So I know, you're a lecturer, and so, you work with and talk to a lot of chiropractors. So I'm curious, at least in relation to, some of the things you're covering or maybe the social media, what are some of the common challenges that those other chiropractors face?
It's communication skills. When you've gone to chiropractic school, there, at least in LACC or the old school in La Habra area in Southern California, it's meant to help you pass the boards. That's what it's meant to do. It doesn't teach you how to communicate, bedside manner, reading someone's body language for one. Other stuff is important too. Yeah, diagnosing, the right treatment plan, adjusting someone to, walking someone through that hasn't done it before. And this is 2025. There's some people out there that have not seen a chiropractor before. It's common. So how do you help someone wherever they are, if you want to call it lower the anxiety, but get a better understanding of what we do? So their first impression, their first visit is I'm in the right place. This doctor knows what he's talking about. He's helped me understand better what chiropractic does. I think that's the key is most chiropractors, they worry about their billing, their this, everything beyond the patient. Once you get in the room, they're like, that's still in their head. So they're like, how do you just focus on that patient? Let everything else be by the side with the patient. So you have that 3 minutes to affect their whole day, their whole week, and maybe even a part of their whole life.
That's amazing. And, like you said, the getting them to trust you, right? And so
Yes,
what's
huge.
the phrase, right? That people don't care how much you know until they know how much you care.
Yeah.
And so
Mhm.
just being for them, and then they'll start to, trust you and listen to you and, you know, follow through.
And making it, I think, fun too, you know? It's making it interesting and fun and maybe you crack some jokes here and there too when you get comfortable with the patient. It's getting to go like, I wanna make this a personal and professional relationship the whole time we're together. It doesn't take much to do that. It just takes practice. Talk like I know some doctors that go out and have a good time with their friends. They're very sociable, come to the office, they're very stoic. I'm like, why? Just be yourself, Crack some jokes with patients. If they think you're corny, you're corny, but it's just being you. It allows them to, again, trust you more because they get to know you more, not just the title.
Right, right. And I mean, ultimately, I believe probably at least most, if not all, people who go to a chiropractor, I mean, how many do they have to choose from? So, you've got however many people on the block or down the street. And so, like, there's something about the doctor specifically that makes them want to go there. So I think you're right. Just be authentic and be yourself.
Well, and a lot of it is we're not going to get someone that's in their Kaiser network or HMO network or Blue Cross network. Not going through a book. They're going to social media, going to reviews, Google reviews, Yelp reviews, whatever it might be, and also looking at their YouTube videos if they have any for one. Also, they want to get to know you before they even step in the door because I'll call it competition, but there's people that are more communicative, whatever it is. At that point, they understand. Okay, I want someone I can talk to and who will listen to me. I want to say not hard to find, but it's hard for people, chiropractors from the other part of the mirror, saying that you can trust me. This is what I do.
Yeah. And it's a lot more than just, credentials, right? I've been practicing this many years
You know,
at college. I mean, there's so much more to trusting someone than the
there's
credentials.
very few patients like, how many years have been in practice? Where do you go to school? And no one. That's nice. Well, we put all our accolades on the wall, whatever it is, too. That's what we do. But it's something like that's nice. But who are you?
exactly.
We assume you have an active license.
Ta-
We assume.
Table stakes. All right. So, what would you say are some, maybe actionable insights or tips that you could share with our chiropractic community who may not even know what they don't know about, say, communication?
A lot of it is just making yourself comfortable as a chiropractor with your patients and helping them understand that you're there for them and spending the time with them. Being able to read body language. And if anything, the biggest thing I've learned the last, say, 15, 20 years or so is staying as quiet as possible, letting the patient talk. I tell myself when I have this, when the patient goes, "Oh, yeah, I went skiing, blah, blah, blah." I'm like, and I've gone skiing before, whatever it was. I go, don't say anything. Let the person tell their story. This time I hurt my back by skiing. Like, "Oh, you went skiing also 30 years ago, same spot." I'm like, "They're not here to hear about you, doc. Don't be dumb. Just listen to their story." You want to listen. What is it? You have, was it 2 ears and one mouth? So double listen than you would talk. Answer questions, but have open answered questions for them that are not yes or no. You want questions that bring insight, not just, did you walk today? What have you taken medication wise? That's on the intake form. Spend 2 minutes reading the intake form first. You come in prepared, not just reading a questionnaire. I think that's the
That reminds me too that I can't remember the exact stat, but like I think the average patient is like listened to, like you just described there. I want to say it's like 12 seconds or something when they go to a medical office. And
Mhm.
so it was kind of like a blend lecture, blend workshop I was at last year. And the doc was like, 2 minutes. It's like, put a clock, like, just let them talk. Like, 2 minutes, most people can get out a lot of that story, right? The things that they have on
Mhm.
their chest and on their mind that they feel like they need to share. And then, like, it just unlocks so much because they feel heard. They feel like you understand them. And it doesn't take a lot. Just listen.
And not that we're therapists, like psychological therapists, but it's something to where we kind of are because they have to be able to tell us the stories further through the assessment in our back of our mind to tell them actually what we think it is and then diagnose it properly and give them a proper treatment plan based on that. But if you're not listening, you're almost assuming what's going on. At that point, you're not letting them, again, get comfortable to trust you when you do come back with a diagnosis and treatment plan, how it's going to help them.
Exactly. And, if there's something they feel like they haven't shared with you, I imagine that's also going to affect their trust and even what their solution is for that case.
And like the goal is they all want to get everyone wants to get better. That's what they're there for. That's hey, people come like, I have posture problems, doc. Can you help my posture? No, I have pain right there. I've had it for 3 or 4 weeks. It's starting going down my arm. I can't lift anything now. Now help me. So I want to give them an idea. Okay, let's figure out what the mechanism of injury, what the initial cause was. Maybe take an X-ray right there, see what's going on. That point, give them the right reason why we're going to see you right now, treat it right now, and make sure it's safe for you. And I always leave the office thinking of you're in the right place. We've diagnosed, probably any more questions. No, okay, you're in the right place. We're going to help you. We've helped. I don't tell them we've helped a lot of people before, but we've seen this before, done this for a long time. Let's help you right now.
Yeah, exactly.
And some doctors do like come in, and this might be more old school. Come in day one, we'll take the X-rays examination, bring you back for day two, more education. We'll treat you the second or third day. I'm like, they're there. Take care of them. That's just my philosophy. I want to help someone right now.
That's awesome. What would you say, like, how do you see things progressing in the near future for chiropractors?
It's becoming more, if you want to call it modern medicine, integrating with your medical doctor, your ortho, your physical therapist to make you part of the even level playing field of what someone needs. As a chiropractor, I'm specializing in orthopedics and neurology and physical medicine. That's all part of my training. And having someone understand, hey, my medical doctor patient, my primary care doctor is saying go see a chiropractor and I'm part of their system is because I'm helping someone. It's becoming more and more common, I think, that that's part of if it works, it works. And most medical doctors, they go, well, I can't, here's the medications that are working for you. I guess go see a chiropractor because I'm not helping you and you won't see me for 3 or 4 weeks.
Right. And, it's not just more comprehensive care, but it's kind of like a team, right? You're each
Yeah.
complementing and knowing what's happening. And so that way you can provide the best care ultimately.
When I could see someone, especially even through their insurance too, I can see them the next day or in 2 days. If you make a medical doctor's appointment with your primary care, we'll see you in about 2, 3 weeks. And once you get that, then they may do some x-rays in 2, 3 weeks, and then maybe an MRI in 2, 3 weeks. And after the x-rays, maybe in 2, 3 weeks, we'll see your PT maybe once a week. And then after so many visits, go to back to your medical doctor. Visit. So by the time the delay process happens, which patients hate, at that point, their symptoms, their condition has gotten worse to where they could have gotten care immediately and boom, take care of the problem.
Exactly. And oftentimes, by the time they get in there, they've been dealing with it for quite some time. It's like
Right.
instead of
And,
just
and, and they leave the doctor going, I need a drug. I've already taken a bunch of drugs. What else do you want me to do? And I had someone come in a couple years ago, mad on a Monday. I'm sorry, left mad on the Monday, more frustrated. He goes, I spent 3 hours in the ER yesterday, got nothing done, got a bunch of meds that didn't work. I came here for 10 minutes. He's a recurring patient. I got treated and I feel much better. Why do you even go to the ER? I'm like, I don't know, Johnny. Why?
exactly. They're there for there's a place and time, right?
Yeah, if something falls off your body, please go to the ER,
Exactly.
please. But if it's not a medical emergency, what are they? And part of it is educating patients. Hey, look, you have this problem going. And what I do too, just I'm more old school because I'm a guy too. When someone leaves my office, I go, here's my number. Any questions, call or text me during normal business hours. I want to make sure you get the right care you need. I'll call them that either they came in the morning shift, I'll call them that afternoon to check them and see how your visit went. And if you got any other questions too, or if they came in the afternoon shift, I'll call them the next day. So part of the care is going to be continuous care availability. You know how many people call me about their problems?
How many?
Zero, because they know I'm already on their side. I already asked all their questions. So they'll only call or text me when there's a major problem. They go, it's bad, but I can wait till Monday. That's why, so I didn't call you, doc, whatever it is. Well, that's good, whatever. But if you have a number, right? Yeah, I do, just in case. Okay, I want to be your just in case.
Yeah. Well, that's just it. And knowing that you're there and available, that goes a long way.
For me, it's authentic too. I go, hey, here's my number. I have a lot of rollover minutes from 2005. That's what I do. At that point, I'm here. I mean, I answer right away, but call me if you have a problem. They go, okay. And I think part of it allows them the relief that they don't have to wait if it is a long weekend till Monday or Tuesday. Oh, I can, but I feel okay. He told me what to do. I'll check his email from before. He said ice or heat. I'll check the email. Said ice. Okay, I sit down. If it doesn't get better, then I'll call him, which is great.
Yeah. Well, and it just kind of goes back to sharing helpful educational information with folks, whether it be email or video or what have you. Be helpful.
And part of it is how they learn too, right? It might be about demonstration, by trying it, by watching a video. So I want to make sure hit all of their senses so they get to understand the material, understand, take care of their own health. Then from there, move on to staying healthy long term.
Yep. And, I think about my own, like I have a massage therapist I see periodically. And so
Yeah.
there'll be certain movements, right? Or certain stretches or things that I'm advised to do. And I find it interesting how hard it is to remember some of those specific,
Hmm.
aspects to the movement. So, you know, I think following up, right, and just being helpful to those people can, they don't know as much as you do or other chiropractors do. So for me, it's just important to remember.
And there's something too called when you leave a doctor's office called medical amnesia. You'll remember maybe 10% of what they said or did. So setting the video of how to stretch, how to strengthen, reminder how frequent to stretch, reminder to ice or heat allows them, oh, there's the email. Oh, this is what it said before. So there's no, I call it homework, but there's no excuse why they couldn't get better between visits. Do you try your stretches? Do you do the icing? So I put it back on them to make them accountable because I see them for maybe on a current patient, maybe 10, 15 minutes, not very long. But can I make sure between visits they're doing the right things to get healthier, better? At that point, long term, get their health and quality of life improved.
Makes sense. And I'd forgotten all about that term, medical amnesia.
I have bunches up in my head. I just got to pull it out whenever I can.
So have you noticed, it seems like it from my side, so I'm curious what you see with the patients, the average
Mhm.
public, if you will, that comes in your office. Like, have you seen a shift in recent years in terms of, you know, people maybe not wanting like the drug or that thing, or like, what can I do for myself or be better educated? Have you seen a shift like that in recent times?
There's a lot, and we know Google. Google knows everything, right? And a lot of these people will Google stuff. They'll ask their doctor. They're more like, I can't. This drug's not working for me. the doctor doesn't want to see me or can't see me in 3 or 4 weeks. It's more of I want help now. I'm not going to wait for 3 or 4 weeks from now. You're available. They go, I can't believe I called today and got in today. Like, wow, amazing. Yeah. A lot of it is they understand now drugs long-term doesn't fix anything. And it's looking for, I talked of other in my podcast too, talk to the doctors about finding the underlying cause and making patients aware that there's an underlying cause causing your headaches, causing your neuropathy, causing your pain. Let's find that, not just cover to mask it with medications. So, and they go, this is what I want. They just can't find it. Because if you ask your doctor about that, they go, you're okay. You're good enough. Your blood work isn't bad enough. Your nerve system are bad enough to do surgery. So what else you want us to do? Drugs aren't working. Let's give you a shot. So it's almost they're trying to go away. And half my patients pay cash because they're going, my drugs aren't working for me. My doctor's not working for me, but I want to get healthier. When someone gets down to it, the health is the most important thing in their life. So at that point, they're going to spend money on it. And I tell them when you pay attention. It's not a $10 copay. Sorry. It's not going to happen in my office. When you pay a pocket, but I'm going to make sure when you're paying your full visit, you get the care you need and you should expect as a doctor to give them more than they expected when they come in your office. They want to leave like, yeah, that's exactly what I wanted. Appreciate it. I go, so anything else you need? I tell them, what else you need before I leave you? Boom. They go, no, I'm good. So I want to make sure they know I helped as much as I could based on their need that day.
Yeah. Well, and not just give them what they want. We'll give them what they want,
Right.
but also give them what they need.
Yes. But it's making that bridge. Okay, I know you want this. Let me give you this too. So we make sure long-term expectation for the next visit is we're expecting this between visits. So if it doesn't change, let me know. That point we can adjust how we're going to help you either here or at home.
Nice.
They go, okay, this is like a 24-hour coach. No, but it's something more. I'm helping them understand how to make their self healthy, not just rely on doctors, medical doctors, or chiropractors, anyone with a healthcare practitioner for their own health.
Yeah. Yeah. I love it. So before we sign off, do you have any final advice that you'd like to share with the chiropractic community?
Couple things. If you're thinking about doing social media, just do social media. You don't have to have the perfect camera, perfect lighting, perfect sound. So my first videos, what was that video? What was that called, Sebastian? It was a little box. And we talked about it last time, I thought. Little box camera. What was that called? Before like even the phone had a camera. It wasn't like a big camera on the shoulder. It was a little box camera and I used that, hook it up to my I think my first Mac computer and download the video. It's something to where people would rather have, in my sense, more volume of your content of how you want people to see you than the quality of the content. But as you progress through videos, get more comfortable with videos, or whatever you want to do, post for 1, 2, you'll get a feel of how to do it. When I came out of chiropractic college, I did not want to talk to anyone. I was not a talker, very introverted, blah, blah, blah. I had to come out of my shell, but it took me time to develop that skill for my own podcast, whatever it might be. And with yours too, Sebastian, is understanding what people want to hear to get their health better. Again, we don't do LPL pages. Boom, you come in, done, deal, or referral, whatever. But now it's like people want to see you interact with your patients, tell your story. Oh, doesn't have to be huge editing and everything else. Just put more content. I want to say, if you can start doing it once a week, great. Twice a week, even better. 3 times a week would be phenomenal. And get reviews too. Don't be shy. Ask your patients for reviews. Hey, how do you find your office? Found you on Google. Do you mind? I always ask them, this is my little joke. Ask them, can you leave me a 2-star review? At least maybe. I love a 5, but 2 if you can. Appreciate it. They go, Doc, I'll give you a 5. All right. I'll ask you next time. So a lot of it is being, if you want to call it, out there, realizing you only build your practice through new patients. And if you want new patients, you have to ask through educational marketing. Again, showing videos, how to exercise, how to stretch, testimonial reviews, a video of someone doing that. Hey, Sarah, and a 1-minute video. Sarah, how'd your treatment go here today? Great. Here's the video. Let's shoot it for 1 minute. Boom, boom, boom. Good to go. Or things like this. Once you get used to that, then do long format videos like podcasts, be on shows, get comfortable being in front of the camera, but it takes time and you'll get there.
Yeah, it's just a matter of really putting in the reps, really, and just get the
That's
practice.
it. And having good eye contact. Use your personality, whatever it might be, from tell some jokes, whatever you can do. At that point, make them comfortable with you to understand, oh, I trust this guy. He's a chiropractor too. I'll go see him when I need him. Easy.
Well, and it's funny too because, I mean, obviously, you need to know what you're talking about, but, you
You
know,
hope.
I hope, but the more someone can literally see and hear you, just that in of itself really instills more trust the more that they do see and hear you.
It's funny, we see about probably 10, close to 10 to 20, 15 new patients a month sometimes. Actually, I'm sorry, a week. Sorry. 10, I'd go crazy if you just saw 10 a week, 10 a month, but about 10 to 15 a week. And if it comes from Google or Yelp or even YouTube, whatever it was, they go, and when they call, and I work with my partner also, they go, I want to see the Google guy, the YouTube guy. And they walk in there and go, that looks like the Google guy. It's something to where you have the recognition, not that you're famous, but people know you or before you even get to meet you, they already know you.
So it's interesting that people are finding you on YouTube even.
Mhm. I love YouTube. And you talked about website too. I think one of your videos and that phenomenal marketing, by the way, Sebastian, just a credit to you for one. But a lot of it is people love websites. But when I get them to the website, I want them on YouTube. YouTube has a library of, I want to say at least 700 videos minimum of what to watch. Again, testimonial videos, podcast videos, educational videos, how to stretch, how to strengthen. For one, two interviews with other doctors, former healthcare practitioners, also from the YouTube workshops I've done, monthly workshops with seniors here locally, how to stretch, how to strengthen for one, two, back, neck, whatever. But it's putting more content out there that allows people to see this is what the doctor does for his, if you want to call it life, not just as a chiropractor. That makes sense. I don't know if that makes sense or not, but
Yeah,
that's what I would say.
a little bit of the walk, right?
Mhm. And I want to say, as a chiropractor, you come in as a disadvantage to your medical doctor because you have to prove yourself that you can help them. Because people had pocket too. Like, well, I'm being in a pocket. Can you really help me?
Yeah, it's kinda crazy considering, like, how often does your primary MD ever ask you, like, "What are you eating? Like, what's your diet? What's your lifestyle?"
Yeah, I talked to Dr. Stone last week about on my podcast. A lot of it is they're looking to categorize you into, do you need this drug, this drug, this drug, or this drug? Not what is underlying cause of your pains and your problems. So you're going through a system that's really not helpful long term for chronic pain or chronic conditions, that you're going to go through that system that's not going to help you. So we try to educate our patients that we're the alternative, in the sense where let's find out and cause and treat that so it doesn't come back again. I don't want to see you within 3 4 months if you have a bad problem. I want to see you when you know the problem's not getting better. I saw them come today, doing your stretches, exercise, ice and heat. Norma, and she's not getting better. I'm like, see me today and do everything you've been doing. Now see how you feel. She goes, oh, that's what you meant from before. Yeah, you're doing everything right, but the adjustments to the one, I call it the one ingredient that you're missing in your recipe.
Mm,
Ooh,
makes sense.
ooh, philosophical. I don't know. There's
Awesome. So, is there anything else we might have missed that you wanna make sure folks hear today?
no docs. If you're out there, just enjoy your practice. If you're not having fun in practice, I apologize, but have fun with your patients. I try to joke with the patients every day. I want them to entertain me as much as I entertain them. I tell them, I have a bird flu joke. I tell them, how's your doctor diagnosed the bird flu? They go, no, I don't know, doc. How does it do that? Your doctor will have you cough and you go, caw, caw. Like, it's a corny joke, but it's something like, doc, that was great. I want them to leave a little bit happy when they came in the door. So and sometimes it's not even my adjustment. Sometimes it seems like you're in the wrong place. Let's get the right place. But I want to make sure they go, man, I came here and I got something today.
Awesome. Well, I feel like I've gotten something here today.
Good, Sebastian. Hope you're entertained.
Absolutely. I know others will be too. So, please also tell our listeners the best way
Good.
to connect with you or find you online.
Good. You'll find my office. It's called Euclid Chiropractic, EUCLID.com. From there, you can find our YouTube channel, our Facebook, Instagram. I think in Facebook, Instagram and TikTok are both Dr. Tony Chiro, DrTonyChiro is my, I guess, a handle or my Insta, whatever it's called. At that point, just put information out there, my docs. You guys, we're all brothers and sisters in the profession. There's enough people out there, abundance of people that have back pain, neck pain, other problems. They want to see you, they just don't know you yet. Put content out there, help them find you so you're happy and healthy yourself.
Yeah, absolutely. Thank you. Thank you so much for sharing all
You're
your
welcome, Trent.
insights and
No, appreciate it. Yeah.
everything. We'll be sure to link to your website and your handles in the show notes in case anyone wants to take a closer look at that or just go right to your profile. And just everything else we covered today will be on growyourchiropractic.com and go in the podcast section. So thanks again for your
All
time.
right.
Appreciate everything, Dr. Tony.
Thank you, my friend. I'll see you soon.